Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Ike here with us today. And she's been suffering from hiatal hernia for how many years?
2 years.
2 years.
Yes.
2 years now. That's been getting pretty severe, though, right? Going up in here and causing severe acid in your stomach and your esophagus and pain in your ribs.
Yes.
Which is a common problem. People get pain in there below their rib cage, substernal. They get a lot of gas and bloating feeling down in there, a lot of belching a lot of times, but acid comes all the way up into the esophagus and sometimes up even into the throat, and it gives you nausea and vomiting even sometimes. And if left untreated or uncorrected, can actually lead to esophageal cancer. So it's a good idea to fix this naturally rather than just taking the little purple pill for it all the time, which is what most people do. And that's really the traditional orthodox medical way of dealing with this problem, is medication or surgery. Well, in chiropractic, what we do is fix the underlying structural problems that are causing the hiatal hernia. So we're not really treating her hiatal hernia or acid reflux, we're treating her structural abnormalities or segmental dysfunction or rib misalignments with the thoracic spine that's causing the diaphragm to be weak and lets the stomach slip up through the hiatus or the opening in the diaphragm. So let's take a look at your posture here first, Ike. Now I'm going to have you put your feet shoulder width apart for me. There you go. And just flex your head forward and then backwards for me, please. And now backwards. And then neutral. There you go. Back to normal now. There you go. Okay, so in evaluating her posture, her head is translated a little bit forward and to the right. That's why her left shoulder is a little higher. Now in her thoracic spine, she's translated to the right of center as well. And she's been getting a lot of pain in her entire left rib cage area. So we're going to be addressing that today and showing you how we do that, because I know a lot of you that suffer with acid reflux / hiatal hernia, GERD is another name for it, gastroesophageal reflux disease, are suffering from the same kind of symptoms. So, okay, good. So, first thing I'm going to do today then is I'm going to decompress you today first. So, this is only Ike's second adjustment and visit. So, she started her first visit with us yesterday, wasn't it? Was it yesterday or Monday? Yeah. Okay, let's scoot you down just a little bit. There we go. Okay, now I'm going to pin your pelvis in right here. So this will be right on top of your pelvic bone here. There we go. Just rest your hands right there on your tummy. Now this is going to feel tight, but just lay flat. There you go. Now most hiatal hernia or acid reflux patients have been told to sleep at a 45-degree angle or on a wedge or something. Okay, just relax your legs. There you go. Let them bend. Come up. There you go. Now bring the legs up. This is the way you actually should be sleeping if you have a hiatal hernia. You bring your legs up with a bunch of big pillows, like off your couch or something. This would be akin to going home and lying on the floor and putting your legs up on the couch. And then I'm going to put this wet towel around her occiput and her mandible, her jaw. Keep your teeth closed for me, Ike. Take a nice deep breath in. Let all your air out. There we go. Good. Did you feel that all the way down?
Yeah.
Good. Take deep breaths. And you're still kicking too. Good. So what this does in a split second when I do this manual spinal decompression is it takes, there we go. Yep. Okay, got one more. Let your neck go right in my hand and wiggle your left big toe. There you go. Good. That's what a lot of people say when they first start getting adjusted and they hear those big loud pops inside of there, which are louder inside, right? Say, oh my God. And God is the one healing her. I'm just the tool and instrument that He's using to do so. So we give Him all the honor and the glory and praise for that. All right, now let's have you come over here on your tummy for me, Ike. Sideways, there you go. There we go. Yeah, play for the Rockets today. Okay, so we're checking her leg length now, which was a ½ an inch short when I saw her yesterday. Now it's only about ¼ of an inch. And it gets even. That still tightens up in your lower back and thighs, right? Yep. Okay. go. Let's put your arms right there and just relax your arms. There we go. Now see her left SI joint is out right there. You can tell she flinched a little bit when I touched that. So I'm adjusting her left SI joint first. And then I'm adjusting the sacrum on the left right there. The sacrum on the right. And then we're going to come over to the right SI joint. Because this internally rotated. We're going to rotate it back externally. L5, straight P to A in the Z axis. L4, pretty much straight PA. Now you notice the angle of my arm's changing a little bit more from a inferior to superior angle, because that's the way the joints are, zygapophyseal joints in the lumbar spine are configured. Now we're starting at where her ribs meet her spine in the thoracic spine. Go ahead and scoot up in there a little bit, Ike. There you go. And I want you to just exhale for me and just keep breathing. Okay, keep breathing and exhaling. There you go. Excellent. There you go. Keep breathing. Yeah. That's perfect. Good job. One more little one right here. Keep exhaling. There we go. What you want to make sure of, chiropractors know this, is that you don't want to adjust the patient when they're holding their breath. Now she's real sore right here, because these are the thoracolumbar muscles, especially bad right here too. And I'm putting quite a bit of pressure on here with my elbow on the paraspinal. You can see my elbow kind of bouncing around there. That's because she's got a trigger point in her paraspinal muscles right there. Right there, I know, sorry. This is one of those hurt so good things. Keep breathing, don't hold your breath. There you go. Okay, I'll be nice now. Now, whenever you have chronic or long-term subluxation or misalignment of the spine, especially where it attaches to the rib cage, you're going to start developing myofascial pain syndrome, which is where the muscles and the fascia covering the muscles gets toxic and very sore and stiff. That's what eventually turns into fibromyalgia, which is a way, way overutilized term in diagnosis of patients these days, in my opinion. People that have widespread chronic pain a lot of times get diagnosed as having fibromyalgia, when in fact their problems are really segmental dysfunction, vertebral subluxation, and joint subluxation in the extremities even, over a long period of time, where the fascia starts getting bound up and becomes fibrous in nature. Therefore fibro meaning scar tissue, myalgia meaning muscle. So fibrotic scar tissue in the muscles. That's what fibromyalgia is. So really, if you treat the things that are causing those sore muscles and get them lined up properly, then and get the toxins, that felt better, didn't it? Yep. Okay, so I'm not going to do the turbonator on there today. I'm sorry, I know you guys like to see people jumping, but today's the first day of fall, so we're going to be nice to Aki today. We are going to, this probably still causes her some discomfort in these muscles. They're still sore, aren't they, Aki? Yeah, she said. Especially right through here. And you can see she has an increased kyphosis in this thoracic spine, which is a too much backward curve. So we're going to be working to decrease her mid-thoracic and lower thoracic kyphosis, which will aid us in getting the ribs lined up with the thoracic spine vertebrae. Then the nerve supply to her esophagus and her stomach and her diaphragm will be stronger. We're going to line the rib cage up so that the ribs become lined up better, so as to provide a more solid and symmetrical attachment for the diaphragm, which runs as a dome right along the bottom of the ribs, all the way around from the back to the front. So we're see, that felt better, didn't it?
Yes.
Good. Okay, so from the very first day she had quite a bit more curve than that, so see, that's already starting to calm down a little bit. Now she's got a little bit of misalignment right here. Okay, so yeah, just relax this in my hand. There we go. Okay, good. So now I'm going to actually just work on some of these trigger points she's got on traps in her levator scapula, which that's where she's getting pain, on their traps and lower cervical spine. So we're going to work on the reason that she's getting those trigger points in there, which are toxins that build up in the muscles called trigger points. Those are sore, I know. This is another one of those hurt so good things. It hurts, but it feels better when it quits hurting. That's one of my favorite lines. It'll feel better when it quits hurting. It's kind of like going to the doctor and say, well, it hurts when I do this, doc. Well, don't do that. It's really the same kind of thing. We got to get through some of this stuff, though, to get where we're going. So let's have you turn on your back for me now, Keith. And this is the part that most people think is all the hiatal hernia treatment is, but it's not. Because, see, her rib cage, boy, look at how much better that is from yesterday.
Oh my God, yes, it is.
That's a ton different. She was over an inch different yesterday in her rib height. Now you can see that it's pretty equal, actually, from side to side. Yeah. I'm going to have you take a deep breath in for me now, Keith. And I'm going to sink my hand in there. Keep exhaling for me. Don't breathe in, just exhale. And I'm grabbing the top of the stomach, which is the fundus, and I'm pulling it down deep, straight superior to inferior, back down through the diaphragm. Deep breath in. Now slowly exhale as I go down. Exhale, exhale. There, I'm going to pull it all the way down. There we go. And that was it. One more. One more and we're done. I know, this is very painful when you first get started with the treatment. And I don't cut much slack on this either, because I need to get stuff done. There we go. Okay, now she's had a little bit of ileocecal valve blockage over here too, which is a little painful too, right there. Now a lot of people think that's their appendix, but there's a valve between the small intestine and the large intestine called the ileocecal valve. So if you eat a lot of popcorn or nuts or kernel corn, peas, things with husk on them, they'll get clogged up in the ileocecal valve a lot of times. Yeah. And over here there's a valve between the large intestine and the rectum, and sometimes that gets stopped up too. And a lot of times constipation accompanies hiatal hernia, acid reflux, and intestinal problems. So I actually do some colon massage, and you notice I'm doing this in a clockwise type motion, and I'm not jamming my fingers down in there, but you do see me getting down fairly deep into the tissues, going through the greater omentum, which is the fatty covering on top, down into the colon, and then rubbing on those. Did you go to the bathroom within 12 hours, like I said?
No.
No? Yeah? Okay. Usually, when I start doing this, people will, if they've been constipated, they'll go to the bathroom within the first 12 hours after I finish doing this. So we'll have to keep monitoring that. That's sore too, huh? It's tensor fasciolata. Okay, so. Alright, I'll play nice for a little while. Here, no, relax your leg. Yeah, that's how you are. There you go. Okay. See, you can't get out here without me pulling your leg and shooting you. Okay, let's sit you up here now and face towards your knee. That way. Okay. There we go. Okay, just relax it. There we go. Excellent. That was her right glenohumeral joint. Relax your shoulder. There's the left glenohumeral joint. And we're going to adjust her ulna, the humerus and the radius and ulna there. That was perfect. And her carpal bones, which aren't that bad, but her elbow is out. And I'm adjusting all the way down to her digits. That's excellent on the elbow adjustment on the left elbow. Wrist is doing pretty good on both sides. Good. Okay, now let's have you come over here and I'm going to shoot you now. Okay, so this is the Atlas specific adjusting instrument that I use to finish every single patient adjustment, because I'm actually creating what's called neuromuscular reeducation in the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement. So I might have you close your eyes again and flex forward and backwards. Back all the way. No, backwards all the way now. And now normal. Okay, that's better. Okay, so her home exercise, she's going to lift her shoulders up, Pull them back. Hold those there for me, Naki. Flare your hands, palms forward. No, remember, palms forward. That tightens up the entire trapezius muscle, which goes all the way down into the lower thoracic spine. I bring her head straight back in the Z-axis. Because she's translated a little bit right, I move her to the left. Shift her pelvis straight right now. Like this. No. Shift. No,
Okay.
don't rotate. Shift. Straight to the side.
Okay.
No, you're rotating it. Shift it straight sideways. Like
Okay.
this.
Okay.
No, you're rotating it. Shift straight to the side.
Okay.
Like this. Okay, no. Push your pelvis straight to the right.
Oh my God, okay.
Here, stand on, move your legs apart, go further. Now shift it over there. There you go, to the side, like that. That's better. Then we're going to hit her atlas right there. Her atlas right here. I'm going to get her occiput too, straight up. There we go. Okay, now, you can relax. And let's go ahead and go forward and backwards again. This should feel smoother to you. Backwards all the way now. And perfect range of motion back to neutral. And her shoulders are exactly even now. You see that? Did that feel smoother to you that time?
Yeah.
And see her pelvis is right down the middle too. And more importantly, her ribs are more centered now. Do you see that equal on both sides?
Yeah.
She's symmetrical now. Up here, here, and all the way down into her pelvis. So, okay, Aki, would you mind telling our YouTube subscribers, has this helped your hiatal hernia in the 2 visits that you've been here?
It is, yeah, it's perfect. I'm feeling better. I'm happy with
Is
that.
this less acid in there? Less
Yes.
pain and discomfort?
Yes, it's less.
Good. That's why you came here, right?
Yes, exactly.
All right. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.